well, actually, 3 announcements. Next month, we are having a program where I will be speaking about medical guidelines. Anybody know what they are? I asked the question last month. Very few of you know what medical guidelines are, but they are going to rule medicine probably in the next year or two. Right? You agree with that? Until they figure out what they are. Number 3, you want to make this announcement or should I?
No, go ahead.
Okay. Tony Gordon, who is related to Eddie Middleman, came to me last week and told me that St. John's University has a speech and hearing center at 15211 Union Turnpike, and they do hearing tests free to any senior. And if you're not a senior, they will accept most insurances so that the fee will be minimal, if anything at all. The flyers this size are outside on the table outside, and if you're interested, I would strongly recommend any of you who think you have a difficulty hearing or have a relative who does, take advantage of this free thing. Now, this is our 6th year, and we've never had an ear, nose, and throat person here. And I was very fortunate to get Dr. Wayne Yan, to come here to speak tonight. Wayne is a graduate of Downstate and was trained at Yale New Haven Medical Center in ear, nose, and throat. Ear, nose, and throat involves everything from here to here, and maybe then some more. And the 2 most common things that they deal with, I think, are sinusitis and rhinitis and stuff in your nose, literally stuff in your nose, and hearing problems. And he's going to discuss each of them. He'll tell you how he wants questions asked and so on. Thank you for coming.
Thanks, man. First, I want to say thank you so much for giving me this opportunity to give this talk. I actually grew up around Forest Hills, so it's great to come to the community and to hopefully to let you guys learn a little bit more about the ear and the nose. Okay, so let's start with this. So with the ears, before I go into talk about hearing, first we got to do a little bit of how the ear works. What is the ear and what it looks like? All right. Let's see. Not really working forward. I'll just control it here. It's not. There you go. There you go. So just a little bit of anatomy. I'm gonna make this really simple. Nothing really complicated. So the ear can be divided into 3 parts. Okay. So you have the outer ear, the middle portion of the ear, and the inner ear. The outer ear is basically your ear canal. It's basically a tube that's about a couple centimeters deep. Thanks.
Got to plug it in.
Yep. Basically, the tube, it consists of a tube that's layered by skin, and on the inside is a little membrane, and it's called the tympanic membrane. Okay, that's basically your eardrum. So when they're kids, sometimes you can see they perf their eardrum, their hurts, and their decreases their hearing. So all this part consists of the outer ear. In the middle ear, you have actually an empty space, which consisted of 3 little hearing bones right here. These are probably the smallest bone in your body. Okay. And sound basically comes in, hits the drum, transmitted through the middle ear, through these little hearing bones, and into your hearing organ. It's called the cochlear in there. From that point on, which is the inner ear, all the signal gets transferred into the brain, and your brain does most of the work, which is interpret language. Okay? So I got a little video here to show you how the ear works. Let's see.
Watch your work now.
Okay, there we go.
I didn't plug it in before.
Let's see what I have to enter.
It usually helps.
Not on. Oh, what happened? Sorry. Technical difficulty. How did I get to work? There you go.
Many of us take for granted a very extraordinary organ, our ears. To understand the ear, we need to understand what sound is. The speakers you are listening to right now are vibrating, flexing in and out, causing a wave of pressure through the air. The frequency of these waves, or the speed at which the sound-creating surface moves back and forth, affects the pitch of the sound. The level of air pressure in each wave is directly related to how loud the sound is. The outer part of our ear catches these waves. It faces forward and has a specially designed structure of curves, helping us to determine the direction of the sound and also emphasize the frequencies used in human speech. Now that the sound waves are caught, they travel through the ear canal and strike against our eardrum, a thin membrane about 10 millimeters wide. Now that we receive the sound, the middle ear transfers this energy. The smallest bones in your body, the malleus, incus, and stapes, start in motion. The malleus is attached to the eardrum, and as the sound travels along, the force is amplified by leverage until it arrives at the stapes, which acts like a reversed piston, creating waves in the fluid of the inner ear. The most significant increase in pressure is caused by pneumatic amplification. The face of the stapes has a surface area of about 3.2 square millimeters, while the eardrum has a surface area of 55 square millimeters. Using this, along with leverage through the malleus and incus, the final pressure is 22 times greater than when the sound first arrived. Now we come to the most complicated part of the hearing, the cochlea. In reality, it is coiled up, but it is easier to understand straightened out. There are actually 3 chambers inside, but let's take a look at the central part. The stapes is causing pressure waves to travel through the structure. Along the inside wall is about 20 to 30,000 reed-like fiber.
Oops. Okay, well, you know what, we can skip this part. It gets a little bit. So, this is a video that probably talks better than I do. So, okay. So in summary, basically,
As the waves move along, they encounter fibers with the correct resonant frequency and energy is released. These fibers aren't actually what give us the signal that we heard something. There is a special structure next to these fibers containing hair cells. When the fibers resonate, they cause the hair cells to move, which then sends an electrical impulse to the cochlear nerve and onto the brain. Certain pitches of sound will resonate in specific locations, and louder sounds will cause more hair cells to move. Our brain interprets all this raw data, making it possible to enjoy things like music or an engaging conversation. Just to think that all of this is happening in your head right now at full speed. This is just one of the amazing systems found in the human body that go far beyond our humble human understanding.
okay. So, that video was pretty nice. I found it online, so I thought it was really educational. So, in summary, how the ear works, basically it transfers sound, which is a waveform of energy, and transfer into electric energy, which is transferring from your cochlea into your brain, so the brain can process. Now, the brain does bulk of the work. Now, hearing loss starts anywhere around the process from the energy transfer. So, there are a couple types of hearing loss. I mean, it can't get complicated, but I like to think about it as 2 types. One is if you have any error or any problem along the middle ear or the outer ear. So, sorry, there's a long list. If you remember, you go back to the first picture. If you have any time you have, let's say, from this part to the outer part, then you have something called a conductive hearing loss, meaning sound just basically doesn't transfer very well into the cochlea. And then what happens when you have something wrong go from the cochlea to the nerve, what we call sensorineural hearing loss. And that what happens is your nerves gets damaged. So for us as ENT, it's easy for us to do something with the outer ear because it's very easily accessible, and when something's wrong, it's usually a connection problem, okay? However, the cochlea is really embedded in the hardest bone in your body. If anybody asks you where's the hardest bone in your body, it's the cochlea, okay? We can't open that. Therefore, treatment is kind of limited. So it's actually very important when you go to your doctor to find out what kind of hearing loss you have. So see if we can treat it with either medically or by hearing aid or by surgery or some kind of procedure that we can do. So what I'm going to do now is I'm going to talk about a couple of types. So we know that conductive is basically through the middle ear and the outer ear. When you're talking about sensory hearing loss, it's through the inner ear, whereas the organ that changes from sound from the fluid wave into the energy from the signal. Okay, now I can give you a huge list, but I'm not going to go do that, okay? So let's go back to the next one. So before we even go into each individual hearing loss. Let's talk about what the sign of the hearing loss. So most people, when we talk about sensorineural hearing loss, when this is sometimes due to age or due to hearing noise damages, people first notice a hearing loss, usually not from themselves. They get told from other people. How many people here actually have heard that their family member saying that, can you speak a little louder? You know, can't hear what? Right? And people usually found out their TV, had to turn on their TV a little bit louder. Most people don't notice they're having hearing loss. There's a reason for that. And I'll explain that to you later. Why, when you actually have hearing loss, you'll be surprised that you don't notice it. I actually have hearing loss. I did not, before I became an ENT, I didn't think I have any hearing loss. And that's until when I was getting my training, I did a hearing test, I found out I have really pretty poor high-pitched hearing loss, which I'll explain later, okay? So mostly, again, by people who change. Another sign is people who have something called tinnitus, which is a ringing noise. Most people will, through their life, will experience tinnitus, okay? So which we'll also talk about in a little bit. So, evaluating patient with hearing loss. Remember that there's different type of hearing loss. What's most important thing is history. First up, we're gonna ask, right? Hearing loss, a lot of time hearing loss, it doesn't come alone. Some people have history of infection. How long is the duration of hearing loss? It can be slowly, for most people, it's slowly over time. Some people have hearing loss they're born with, they're hereditary. And very important, also associated symptoms. People have certain symptoms, they're ringing in their ear, vertigo. So these are the important things you gotta think about and talk to your physician. We'll also talk about a few things later, which is really important. You should seek medical care immediately. Even though hearing loss is a very indolent, most have think, I don't want to think about it, but there are certain things you really should think of it, go see a doctor right away, okay? So, first thing we usually do is look at it, get the history, and then we gotta look at your ear and see if it's actually really an outer ear problem, a middle ear problem, or if it's an inner ear problem. We gotta make sure all the stuff that's non-dangerous, that we can fix easily, and then if all the ear looks normal, then we'll consider doing hearing aid, doing more testing. So this is very important. Screening tests. What do we do for screening tests? Usually, if you're a doctor, everybody ever seen the tuning fork people are using? That's a great screening test if you can hear. Or you can just cover your ear, do it yourself. Can you hear anything out of one ear? That's just for patients themselves. But for us, we usually really objective test is doing an audio booth. This is how audiogram is done. Usually, patients sit in after we examine the ear, make sure there's no wax. Patient usually goes into an audio booth. It's a little room, and you're gonna put headphones on, and you have an audiologist who perform the test. So if you guys go to St. John's, this is how it's done. How many people actually here had hearing tests before? Oh, good. So most of the people have it. So you guys all experienced this before. Very good. So what do we test for hearing? There are a couple of things we test. So I'll make a simple show, because actually if you look at a hearing test, it's very, very confusing for most people. You see a bunch of dots, bunch of lines. What are we actually measuring? There's actually 4 things we're really looking at. First is what we call the pure tone, but in a sense we just see how loud is your ear. Okay? How loud the noise is, and how can you perceive sound. Second is the pitch. So what do we see by loud? When you look at a diagram on your hearing test, what you have is on this axis is how loud it is. It's the loudness of the voice. It's measured in decibel. So for a normal conversation, it's about 65 decibel. However, if you're at a rock concert or you're in an airport plane taking off, it's going to be very, very loud. Of course, if you're doing a hearing test, if you can hear all these, they'll give you more usually beeps. If you can hear beeps up here, that means your hearing is pretty good. Now, if you have to give you the same sound level beeps as an airplane taking off, we're in trouble now. Okay? So the second thing is we talk about pitch. That means how high the frequencies are or how low it is. So when we sing words, all the vowels are actually in the low pitch frequency, whereas all the consonants are in the high frequencies. Loud, when you perceive a word, vowels, the word A, E, O, U, these vowels actually it tells you how loud the sound is. However, to make a word meaning, to discern meaning and clarity of the sound, you need the consonants. And that's where it's in a high frequency. Most people, when they have sensory hearing loss, do you remember the cochlear where the hair cells are aligned in that video? People lose the high frequency hair cells first. So most people, when they have a hearing test, it looks like this. It's a downward slope. Most people lose it in a high frequency. Now remember, high frequency doesn't tell you that how loud the noise is. It tells you how clear the noise is. If you lose the high frequency, you can still hear words. However, sometimes you cannot discern words, especially in a noisy places. If you're one-on-one, if I sit here talking to you, most people will hear if you have a certain type of hearing loss. But if you go into a very noisy places, most people can't start. You can hear something, but it sounds like all mumble jumble. And those are my patients that comes in and say, Doc, you know, I can hear. I don't think I have any problem with ear. It's just when I go out noisy places, I have to say it again. These are the people who actually really needs a hearing test. They actually really have hearing loss, except that they don't really notice it. But most of the time after we do a hearing loss, their slope is really up. On their high frequency hearing loss is pretty bad. Okay? Also, these are the people most likely to have tinnitus. When the high frequency healths start dying, most people will start having tinnitus. I'll explain tinnitus in a little bit, because that's actually it's a very, very common problem I see in the patient. So, let's talk about specific problem, the most common cause of the hearing loss. Number one, anybody want to tell me what this is? Huh? No, that is wax. One of the most common reasons for hearing loss is actually wax.
Chestnut.
Yeah, it is.
What's a donut?
Now, what is wax? Wax actually is a miscommon perception. Wax is there to protect you. Yes, it's a secretion made by our glands in the ear skin. It's really there to protect you. Okay? The ear canal skin is very thin. It's the only place in our body where skin's just over bone. And now most people when it comes to me all use Q-tip. They think wax is dirty. Wax is not dirty. Some people tend to build up a little bit more wax, and when you have wax like that, it can plug up your ear. Sound does not get travel. It does not get travel into the membrane, so it doesn't vibrate. You still can hear. It'll be very, very muffled. Okay. So the first thing to have a doctor take a look, see if it's wax. Most people who develop hearing loss from wax, it has to be plugged completely. Even if you have a little bit of space, you can still hear. Okay? And please, no Q-tips. It's the worst thing you can do to your ear. Okay? Next. That is another type of conductive hearing loss. This is the tympanic membrane. Remember that picture I showed you before, that 10 millimeter membrane? Here is a hole in the ear. Now, what causes a hole in the ear? For most kids, probably ear infection. Kids usually develop ear infection more than adults. Okay? There's a specific reason why kids develop holes on the drum. Because kids, the eustachian tube. Anybody know what don't know what the eustachian tube is, right? Okay, so a eustachian tube is actually a small tube that connects between the ear and the nose. It has multiple functions. One of the main function is to equilibrate air between the middle ear and the nose. People flying, taking off when they're flying, you know how the ear hurts? You feel that pressure in the ear? That's because the eustachian tube is not opening. So for a lot of people who has the eustachian tube problem, but most people, when they're plane taking off, what do? You swallow. You hear your ear pop, and you feel a lot way better, right? That's because the cabin gets pressurized, but your middle ear, which is behind the drum, hasn't changed. The pressure hasn't changed yet because the eustachian tube between the nose and the ear is closed. As soon as you swallow, the eustachian tube opens, the air flows in, pressure equilibrate, you can hear. However, in kids, a lot of times the eustachian tube is more horizontal, and the eustachian tube is not very well developed. Kids can't open that eustachian tube very well. What happens is the pressure inside the middle ear becomes negative, and the drum gets sucked in, and secretions start. They get middle ear infection a lot. A lot of kids in this country has ear infection. Why kids pulling their ear? That's the reason. And a lot of times, because the infection didn't get treated or go unrecognized, they develop a little hole on their drum, and that can reduce the hearing loss too. And also trauma to the ear. People get slapped. Pressure can also cause a little hole in the ear. And I have seen many people who use Q-tip in their ear cause a trauma like this. Most of these drum, if it's uncomplicated, meaning you have no infection, if you have just a drum, can be easily fixed by surgery, or even if it's a tiny little perf, can be fixed by a little procedure in the office, we would call paper patch. If it's recent perf, so when you have a perforation for hearing loss, it's actually very treatable. Okay? Next. Now, this is a bad infection in the ear. It's mostly caused by swimming, people who swim a lot. And the ear, you see how ear canal is very swollen? People mostly have a lot of pain. They even have discharge coming out of the ear. This is a typical bacterial infection in the ear. It tends to happen with people who swim a lot, or people who pick their ear a lot. So the ear canal can be very swollen, but this is also a bacterial infection, can be treated pretty easily, usually with antibiotic drops. So again, I'm only talking about the outer ear problem that causes an ear infection. Next. This is when we go one step further into the middle ear. This is what happens when you have middle ear infection. This is when the eustachian tube is not opened up. You have all this little bubble behind the eardrum. This is a fluid buildup, which you see in kids a lot. It might not be an infection, just you have fluid. This does not have any infection. There's no bacteria. It looks so clear. So it's still sterile. There's meaning there's no bacteria. This is not an infection. But just because you have fluid and the drum doesn't vibrate very well, and you can have a hearing loss from that too. Now, this tends to happen in kids more. In adults, this can happen if you have a cold or if you have a sinus problem, because the nasal mucosa, the nose mucosa, is connected to the ear. Remember I talked about the eustachian tube? So this can happen after a cold. Has anybody ever had this before? After a cold, they feel their ears muffled, but give it a couple of weeks and it can get better. Exactly. So this problem on the first picture on the left is usually well resolved on its own, given a couple of times. You do need a medication for the first one. Now the second picture here is because you have fluid in here, what happens is in the nose, it's colonized by a lot of bacteria. The bacteria can certainly travel up the eustachian tube and cause an infection. And that's what happens. This is called acute otitis media. That's actually when you have infection. Patients usually have more pain, they can develop fever. Again, this tends to happen in kids more than adults. Okay? Now this is just a picture of the eustachian tube, what I talked about before. In kids, the tube is more horizontal, it's smaller, whereas in adult, it's more slanted. So any mucus buildup in here can drain down by gravity much easier. Okay, so we talked about mostly the middle ear and outer ear problem causing hearing loss. Now, sensorineural hearing loss, this is mostly adults, why they have hearing. There's a lot of problems. The most common thing is presbycusis. This is just due to aging related, which we see a lot. And this type of hearing loss, usually it's gradual, and usually the hearing loss is in the high frequency first, okay? For people who has this type of hearing loss, should get a hearing test. Can it get worse? Yes, it certainly can over year. Usually we recommend people who has hearing loss every 1 to 2 years, trying to get a checkup and repeat their hearing, make sure it's not getting any worse. The next one I'm talking about is actually quite important, is noise-induced hearing loss. Most people don't realize it, especially young kids, people like me. I did not realize I have noise-induced hearing loss until I went to med school. I used to listen to rock and roll, listen to our music, put on earphones while studying. I did not know. Here, take a look at this. I just want to show you a picture here. Take a look at the noise thermometer here. OSHA, which states that any sound over 85 decibel, you get permanent ear hearing damage after 8 hours. Okay? So when you're listening to iPods, even riding a motorcycle, you get hearing damage about like 2 hours. When you listen to iPod at 94 decibel, in 1 hour you already get some damage to your hearing. So if people who listen to loud music, going to a concert, protect your ears. Okay? If you go to a rock concert, wear earplugs. Even if you're surrounding, working in a very noisy environment, definitely wear hearing protection. So this is very actually important. Most of these type of hearing loss, it's a very loud sound. If the noise-induced hearing loss, if it's suddenly like an explosion, most patients recover spontaneously. It's actually quite reversible. However, if this is over time, it's not reversible. Okay? So this just be aware of that. There are other important that can cause other troubles. I'm sorry. There's other etiology that can cause hearing loss in the inner ear. Sometimes due to, as we age, some of the vessel, might just like stroke, can plug with a small clot. That can certainly cause a hearing loss. Sometimes a little viral infection in the inner ear called labyrinthitis here can also cause hearing loss. Autoimmune disease can cause hearing loss. The key is watch at the onset. When do you really, if you have a hearing loss, when do you really need to go see a doctor? Very important. One is, this is the entity we need to worry about. Sudden sensory hearing loss. This is, you have no history of ear infection. All of a sudden, one day you woke up, I can't hear anymore. We don't know exactly the etiology. It's only 1 year. We are guessing this is most likely from either a viral infection or small vessel that had a little stroke in the ear. With this type of hearing loss, only 50% of the people recover their hearing. And I actually quite see this quite a lot even in adults. Okay? The only thing that really can help is get to a doctor as soon as possible, check your hearing, and if this is really true, steroids is the only medication that can reverse this in about 50% of the people. A lot of people do not have, some people cannot recover after this type of hearing loss. So if anyone wake up one day, all of a sudden their ear suddenly cannot hear, you should go to the doctor right away. It's pretty important. The timing is really the issue. The longer you wait, the less chance of hearing. Yes?
Do these problems occur symmetrically in both at the same time?
No, usually this is only unilateral, meaning just one-sided. You wake up one day, one ear doesn't hear. And a lot of people with this type of hearing has also other symptoms, such as vertigo, or some people have ringing in their ear, which I'm going to talk about ringing. With hearing loss, ringing it goes hand to hand. So let's talk about it. So this is the next one. Ringing. What is ringing? Ringing in the ear is called tinnitus, the medical term. What is it? It actually has two types. There is a subjective or objective ringing. Okay. Tinnitus is described. The definition of tinnitus is a sound that patient can perceive, but no one else can hear it. Tinnitus can be described as a ringing, a high-pitched noise, a cricket noise, a humming, or even pulsing. So, how many people here actually have tinnitus? I would think almost everybody here have tinnitus. I have tinnitus. Sometimes I can hear, has anyone ever sometimes go, hear a noise in their ear before? Right? It can stop right away. Now, tinnitus, what is tinnitus? We actually really don't know. We can guess a lot what a tinnitus is. There's a lot of theory on it, but nobody can actually prove it. Tinnitus, what's dangerous about tinnitus? There are a couple of types of tinnitus we need to aware. First of all, we need to describe tinnitus in two senses. Is perceivable by other people, meaning a subjective or objective. A subjective tinnitus is only the patient himself can hear it, whereas objective, other people can hear it. Thank God mostly it's subjective, meaning only the patient can hear it, other people can't hear it. There's only a very few causes that can cause a subjective tinnitus. So for that sake, I'm only going to talk about subjective, which is the most common type of tinnitus. Now, even with subjective tinnitus, it can be described as two types. One is a pulsing. The question you want to ask is tinnitus pulsing. Does it sound like your heartbeat? Because if it sounds like a heartbeat, most likely it's a vascular problem, meaning it's a blood flow through your ear. So there's actually maybe an underlying medical problem. So if you have a pulsatile tinnitus, it's something that you should look into. Now, back to the other non-pulsatile tinnitus, which is probably the most common type of hearing noise in the ear. And that is highly associated with people who have hearing loss. The reason we don't really know, it's actually a symptom. Tinnitus is not a disease. Most people come in, hey doc, I have this tinnitus, I have this problem. I tell them this is actually a symptom presenting of you have some type of underlying problem. We don't know what it is, so we should have to find out about tinnitus. Because I would say, almost everybody has tinnitus. And when do you have tinnitus? It's when it's quiet. So what is tinnitus? Most people, it's not well understood, but the biggest theory on tinnitus is actually a consequence, it's a brain's response. We actually also call it an auditory illusion, because your brain makes this sound. Why does the brain make sound? Our best guess is when patients mostly have hearing loss, they lack an input into the brain. Now, when the brain, this is how the brain responds, by changing the neural pathway and then causing different neuron firing and then presented with this type of noise. Okay? So, is there any testing we can test for tinnitus? Unfortunately, no. Now, I have seen a lot of patients come to me and say, hey doc, I've been to many, many doctors. My doctor tells me that tinnitus has no cure. I have no hope. So I'm just getting bounced around. You know, I feel bad for the patient because tinnitus is treatable. Tinnitus has a cost. Yes, it's difficult. So first question when a patient comes to me with tinnitus, first you gotta ask, is this pulsatile? Not pulsatile. Okay? If it's a pulsatile tinnitus, we need to work up, find an underlying medical problem. People who has thyroid problem can certainly have tinnitus. Okay? They have the pulsatile because the thyroid can cause blood pressure go up, heart rate goes up, and you can hear the boom, boom, boom noise. It could be a vascular tumor, could be a thinning in the bones in the ear. So these are the things that we actually look for people who have tinnitus, and we can treat it subsequently. Now for patients who have non-pulsatile tinnitus, because remember I told you before, tinnitus is really, it's a brain response to lack of hearing, lack of input. So the first thing we should check is patient's hearing. So it's very important, okay? Again, because quieter the room, the less the input into your ear, patient most likely will experience tinnitus when they go to sleep, when it's quiet. So I tell people, some people it's really bothering their night. They can't sleep because the ringing whoosh whoosh sound in their ear or ee noise like that. They really can't. So what I tell people, first of all, rule out, make sure there's nothing else going on first. Second, when you're at night, the best strategy for treating tinnitus at night, first is think of masking strategy. What's a masking strategy? You mask the sound. Don't think about it because your brain makes the sound. There's really no sound. It's your brain telling you there is a sound. So how can you do it? You gotta fool the brain back. Turn on a little bit of noise, a little fan in the background. That can help too, yes?
Is there a difference in the number of people suffering from tinnitus in the quiet country and the noisy city?
That depends on how much hearing loss they have. It depends. People who lose a lot of hearing, the more hearing loss you have, from my experience, people have more likely hearing loss than tinnitus. But it does not exclusively, because people who has hearing loss may not have any tinnitus, whereas there are people who has tinnitus have no hearing loss. Okay, yes, go ahead.
Can trauma
Cause tinnitus? Certainly. Some like noise trauma can certainly cause tinnitus. Even brain trauma, if you have certain type of hearing loss, people who had a head trauma can have tinnitus as well. It can certainly cause hearing loss. People who have stroke, because the organ, remember how I showed you the ear, anything that can damage the outer ear, the inner ear, can cause hearing loss. Now, again, hearing loss, as I said before, I hope you understand that anywhere along the pathway can cause tinnitus, it can cause hearing loss, therefore can cause tinnitus. Most people come in with a wax buildup, can have tinnitus, have ring. I take out their wax, they're like, oh, it's gone. Okay? Another thing can actually assist with tinnitus is actually hearing aids. For people who has tinnitus, a lot of tinnitus and hearing loss, because by putting in that input, giving the brain something else to think about, they actually can improve their hearing. Their tinnitus symptoms. Yes?
white noise?
White
Music?
noise. Yes, that's what I'm talking about.
Got a little machine that goes waves or
Excellent.
rain or?
I tell people there are specific white noise. What white noises means noise from all frequency.
Right.
You can get specific, if you want to be really fancy, you can even go ask your audiologist. Get specific noisemaker that only matches your tinnitus, because tinnitus happens at certain frequencies.
Right.
Audiologists can buy you, they can get you specific masking machine, but those things are pretty expensive. So I tell people, use your iPhone. Everyone's got an iPhone these days, right? You can download white noise app. Oh, you don't have, okay.
My son bought me a small machine
Mhm.
that does raindrops,
Mhm.
ocean waves,
Mhm.
wind.
Mm-hmm.
I think there are 4 or 5 different, you switch them on.
Switch it, and that helps you feel like at night?
It lets me sleep, yes.
It lets you sleep.
Or I sometimes put the radio on as well.
Now, one thing I am gonna buy against about tinnitus is because American Academy of Otolaryngology just published an update on tinnitus recently. Well, it's about a year ago. No medication. They do not recommend any medication for tinnitus. Now, I did not say there is no cure for for tinnitus. Okay, there are cures. There are ways we can get around, can relieve patients' symptoms. However, there is no medication. I know some doctor will like to give certain type of anxiolytic medication. They might give some vitamins. All these, there is no accurate data for any medication for treating tinnitus. Yes, go ahead.
Yeah, I take lipoflavonoid.
Yes.
And it doesn't go away, but it's less than.
Right. So there are studies have been done with lipoflavonoid. I have it in my office. I never run them. Okay. Some people works, some people doesn't work. There actually have been studies done that compare the two arm people who get placebo effect, placebo and lipoflavonoid. There's no difference. Go ahead.
Just, if there's no cure for tinnitus, how can you always see those commercials on TV all the time? No, I'm serious. It's-
Which ones?
There's a doctor on Long Island, keeps on the radio, keeps on saying, I can cure you.
I'm sure we also have that commercial. There's more than one.
Well, let's just put it this way. I believe in evidence-based medicine. Okay, that's how medicine is practiced these days. Evidence-based medicine. So that's why we have trials, we have multi-center studies, that we go through all these double-blind study trials where they compare patient in different groups. They give it different type of treatments. And from all the study that we have seen, there is no difference. Sometimes it might be just placebo effects. I can tell you, most of my patients, I think I educate them more about tinnitus and what causes tinnitus, rather than just give them, I'd rather spend the extra 10-15 minutes talking about, like this, telling them what tinnitus is.
So those things basically do nothing. Those things you see on TV.
I do not believe so, okay? There are certain therapies that American, if you're interested, I think I'll show you the website later, AAOHNS, which has a lot of great guidelines, article about tinnitus, about sinusitis, which you can certainly, I actually recommend my patient go through them. It's actually pretty easy to read some of the information. They're very good about on hearing loss and tinnitus.
Could you repeat the name of the website?
Yes, you can do a Google search at AAO HNS. It stands for American Academy of Otolaryngology Head and Neck Surgery. It's a little long, sorry, but if you just search AAO HNS, it'll pop up. It's the first thing. It's our academy. Okay? So any other question about tinnitus so far? Yes, go ahead.
Can different patients react to different musical instruments as a relief from tinnitus? Like someone can get relief from a trombone, and another person get relief from a trumpet.
Certainly. Remember I told you before, tinnitus is matched in different frequencies. So I guess instruments can come up with different frequencies. So some people use to certain sounds better. Most people I told use white noise, which is all different frequencies. So, I mean, the major problem with tinnitus is not well understood. That's why. So I think it can be certainly tailored. There are also cognitive therapy, behavior therapy, which some audiologists can do, which can improve tinnitus symptoms as well. Okay. Again, tinnitus to me, I think tinnitus is very bothersome for most of the patient, and majority of patients does have it. I think one of the things, and it should be really tailored to each individually. The most important thing for me for tinnitus is to rule out the bad stuff. And when people have tinnitus, I have a ringing noise, not a big deal. No, I think at least get checked out by an ENT or even by your doctor. Just make sure someone look in your ear, make sure there is no wax, simple stuff that you can do to get rid of it. And the next step we'll usually do a hearing test to see if there's anything wrong with your hearing, which can be caused by tinnitus. Sometimes there also another school of understanding about tinnitus is that patient has, it's related to stress, because there's another paper I have read recently that tinnitus has to do with something to do with the limbic system, which is controlling your emotion and stress level. So a patient who has a higher stress of anxiety also can tend to have tinnitus. They don't have to have any hearing loss. Okay? Even a normal person, if you put me in a quiet booth area, in a booth there's no sound, lack of a depreciation, nothing in the ear, I can develop a tinnitus. It can be pretty awesome. I had it once, I was sitting in a hearing booth for about 20 minutes. I started developing tinnitus myself, and noise like this. Okay, so the last part of this little talk about hearing aid is, about hearing, is hearing aid. Now, when should I get hearing aid? That's one of probably the most important questions, right? Why do I need a hearing aid? When should I get hearing aid? Should I get one? Should I get two? Which type of hearing aid should I get? Now, I'm not an audiologist, so I can't tell you which type of hearing you get. But I am going to tell you, if you feel like, if your doctor tells you you have a little bit mild hearing loss, get the hearing aid. I'll tell you the reason. The simplest way to put it, your brain, remember your hearing, your ear, basically transfer the end of the sound into signal into your brain, right? Your brain is the workhorse, it processes everything. Your brain is amazing, but the brain is like a muscle, okay? You don't use it, you lose it. So when you have a mild hearing loss, you're already losing some of that signal, that stimulus, that input. The area in your brain that processes speech can go down, okay? So, for a perfect example, for children who develop hearing, a lot of children, congenital born children, they develop hearing loss as a child. They can never develop their speech correctly. Their speech goes wrong. Some even old elderly folks, they have hearing loss, they refuse to wear a hearing aid. Over many years, you can see their speech start to change, start to slur. You know, even at that time, if you're here, so I actually have a lot of patients that comes to me, very bad hearing. You look at their audiogram, the beep, beep, beep noise, they actually can't hear. It's bad, but it's not that bad. However, if you put them into when you talk into speech, one thing I actually forgot about, when they talk about hearing tests, we also measure your speech, see how well your brain can perceive speech. One part of the hearing test is you repeat back 25 words the audiologist said. This is actually this is more important than you can hear the beat when you can interpret speech. And that's a higher processing function. Now when you lose your hearing and you don't restore it, your brain gradually loses that processing area. And I think if you get the hearings early so you don't lose that, okay? Over long periods of time, you don't use it, the hearing is going to decrease, the brain processing area can decrease. There's also a recent paper has suggested that people who has a lot of hearing loss over a long time, especially the elderly, can develop dementia. Because when my patient comes in, when they have a lot of hearing loss, most of the patients, what they do, they're afraid to go outside because when people talking to them, they can't understand. So they tend to more or less socialize, they don't want to talk, they don't want to go out, so they keep them home by themselves, and their brain processing goes down even further, their brain function. So that's probably a way, that's what we are thinking about how it related to dementia. Okay, so now there's multiple different type of hearing aids. I'll give you my 2 cents on hearing aids. Okay, they're behind the ear, inside the canal, outer canal. So this is really tailored to each individual patient. Now, hearing aids traditionally, what is hearing aid? A hearing aid is a device that basically amplifies sound. In the back of everything analog, they amplify all frequencies. Remember I told you a bit patient, most of the elderly patients lose the high frequency hearing first. Nowadays, hearing aids are digital. So it can not only amplify sound, it can only choose the specific frequency that it amplifies. So you don't get that much noise. Most of my patients they don't like hearing aids, one of the major things, it makes too much noise. Because some of them, they have older hearing aids, and when they take out, it has a lot of feedback noise. That's one of the problems. And also, for a patient who actually has the different type of hearing aids could also improve different type of hearing. They're open fit, which means all you have is just a little tiny thing in the ear. You can still hear most of the noise naturally by ear. The hearing aid only amplifies the sound that you need to hear. So talk to your audiologist. They're the one who really can tell you which one that you need. Yes?
Somebody mentioned to me something about an FM hearing aid.
I don't deal, sorry, that I really don't deal too much with the hearing, this specific type of hearing. Yes?
You said that loud sound can damage your hearing.
Correct.
So if the hearing aid amplifies sound, are you damaging the
Well,
hearing further?
Not necessarily. They don't tune it that high, not to that level of loudness. It really tailored to every patient. It tailors to you. That's why don't use anybody else's. So my patient like, oh, I got one from China. My cousin got it, so I just took it and I use it. No. So it's really tailored for every patient. Okay. Now, certainly there is a point where some people's hearing can't hear anymore. You have another option. It is something called a cochlear implant. Anybody ever heard of cochlear implant? Okay. Anybody know what it is and how does it work? You do.
It's a surgical implant,
Yep.
partial to go into the cochlear,
Correct.
being on the outside of the ear.
Mm-hmm.
And but there was a program once that showed a child had never heard before, and that the surgery was done, and the child heard the mother's voice for the first time.
Correct.
It was-
So a cochlear implant, I just wanted to briefly touch up on because I think there are people who has probably a question about it, so everyone understand. Cochlear implant is a device, as she said, it's an implant directly into your cochlea because your cochlea is probably something not working in your cochlea. It's mostly for a patient who has profound bilateral hearing loss, meaning you can't hear out of either ear. Okay, if you can hear out of one ear, usually you don't need to, and FDA won't approve it. It's only when you have both hearing has to be a certain level, and you have to have tried hearing aid both sides, trying it for 6 months, and there are special tests that you have to go through. Now, cochlear implant is not a device that anyone just can use. You need certain time of training. It usually takes about 6 months of training after the surgery to use a cochlear implant. Okay, this is really reserved for a patient who has no hearing at all at the end. Okay. Any other question about the
What
cochlear
about
implant?
babies that need the cochlear?
Right. Babies who need cochlear implant usually are born congenitally deaf. And the best time to get cochlear implants are when you're a kid, when you're newborn, who has never learned any speech. Those are the best kids who have cochlear implant right away. Kids these days gets screening, at least in this country, gets a screening test when they're born. And they get repeated multiple tests when they're older. And even going to school, you have to have passed certain type of testing. Usually with kids, you got to check for their speech. Should check their speech. A lot of times we see kids who develop speech late. You got to check their hearing, make sure it's not a hearing problem causing their speech delay. Yes.
You spoke about these hair follicles, that patients lose these
Hair cells, correct.
hair cells
Yes.
and causes loss of hearing.
Mm-hmm.
And the doctors tried a medicine which I heard is good for growing hair on the head,
Okay.
called finasteride. Have they tried that? No?
It's a different type of hair cell. They're not the follicle of these type of hair cells. These are neurons that has a little cilia on top. It's not really a hair. It doesn't look like this type of hair. It's really just a special neuron. It's not really a hair cell. So it's a totally different type of cell. The problem with that is, again, what I said, the cochlea is a sealed system. It's the hardest bone in the body. Even nowadays, we can't open the cochlea. Anytime we open, it gets a little complicated. Anytime we open the cochlea, you lose all your hearing. Because in order to remember that video I showed you before, hearing is transferring the sound. Once it reaches the cochlea, it vibrates the fluid inside the ear. Now, the video doesn't show you technically what's more complicated is between the three compartments, there is electric gradient. There are ion flowing, which is anytime the hair cells start moving, ions from one chamber flow into the other chamber. And that's what causes the flow of the ion generates the electricity. And that's what, well, it's a current, I shouldn't say electricity. It generates the current. That's what the neural signal is passed. So anytime you open these compartment, the ions gets flowed out, you lose that gradient, your hearing is gone. Yeah. Yes, go ahead.
Cochlear implant is to the brain itself or the?
No, there's actually certain thing called brainstem implant. That's too complicated. I wouldn't even go there. Cochlear implant, one thing is it's not a natural hearing. Some people think, oh, I get a cochlear implant, it's like a hearing aid. No. Cochlear, in order to get the cochlear, why do we say you have to lose all your hearing to get cochlear implant? The biggest reason is we actually destroy your natural hearing. When we do the surgery, we actually open. Remember I told you when I open up the cochlear, your natural hearing is all gone. So when we do the cochlear implant, we actually open your cochlear. We actually put a little electrodes through the snail thing, right? There's a little window called a round window. We put it in. That way, it destroys all your hearing right there. The cochlear implant actually sit around all these hair cells. We actually produce all the electric current directly onto the hair cell and stimulate the hair cell.
Why can't you connect directly to the auditory nerve?
Why can't you connect to the auditory nerve? The surgery is too complicated. There's going to be a lot. You have to open the whole ear, drill. You have to find the nerve. Not only it is anatomy question. The hearing nerve, the balance nerve, and your facial nerve are together. So if I go look for your hearing nerve, there's a big chance I can make your face go like this. You're going to paralyze your face. So I can't just go in there and do that. Okay? Yes, go ahead.
Can you damage the sinus canals by eating very cold food like ice cream? Sometimes,
no, we actually should.
sometimes I eat ice cream, I go, oh wow, I shouldn't have done that.
No. You're not going to. No, that's a myth. Let's go on to the next talk. Let's go talk a little bit about sinus. Sorry, I got to upload it.